In the interest of time, I think we'll get started. I wanted to introduce myself. My name is Sue Robson, and I am working with Kidney Cancer Canada. And I wanted to, first of all, welcome all of you that are here in the auditorium and those that are joining us by webcast. I think we have about 10 or 11 people joining by webcast at the comfort of their home in front of their computer. And I wanted to just share with you a couple of things about Kidney Cancer Canada. Yes, I did there. So who are we? Kidney Cancer Canada, as it said, was founded in 2006 by these two individuals that are standing there, Dr. Basapa and Dr. Moore. I'm sure know the woman, Deb Maskins, and the gentleman with her is Tony Clark. And they were sitting in the waiting room at Princess Margaret Hospital getting treatment for their kidney cancer when they both started talking to each other and realized there was very little information for patients specifically about kidney cancer. And hence, the two of them talked and started saying that they wanted to form an organization. So they created Kidney Cancer Canada, which is the first and only patient support and advocacy group in Canada, and it still is. And it's exclusive for kidney cancer. So who are we? We're a growing patient and caregiver community. You can see on the map that it started in Toronto but has grown across the country from around 2 people to over 2,000 members now, which members being patients as well as their caregivers and family members. And the mission is very simple, but it's also very strong and very important: to improve the lives of those that are affected by kidney cancer across Canada by providing support, information, and education, raising awareness about the signs and symptoms of kidney cancer, raising funds for research, and advocating for patients. And that is something that we believe very strongly in, and I personally spend a lot of my time advocating to the different governments in the different provinces to try and make it true that we do have universal health care across this country, which indeed we do not. We are very lean. We have 2 full-time staff members, myself and a woman who works in administration in the office and holds us together. And we have 1 part-time person in Quebec who is French-speaking and helps us with translation as well as events in Quebec. We have a working board of directors. Many of them are patients, some are caregivers, and many of them are professionals who are giving of their time and expertise to Kidney Cancer Canada, which is extremely important. We've logged right now, since around 2012, about 3,800 volunteer hours with around 80 volunteers across the country. And this may not seem significant, but when you're a very small organization like we are, we depend on volunteers to be able to make things happen, because without the resources, we need people that are going to help do all sorts of different activities. We don't have an office. We all work from home and communicate via email and Skype and face-to-face. And I have to say, I cannot take any credit for this, but the woman that was in the picture at the beginning, Deb Maskins, has really been very responsible for the creation of Kidney Cancer Canada and their reputation as being very reputable, very ethical. With the Medical Advisory Board, we have 19 renal cancer experts, and they are experts across Canada. So we're very, very lucky to have that kind of a medical advisory board. We also are a part of Kidney Cancer Canada Nurses Network, and this is a wonderful opportunity for nurses that are working in centres just like here at the Cross, who do work in kidney cancer, where they can be a part of a bigger organization, where they can share and collaborate best practice, they can work together, they can share different information so they don't have to reinvent the wheel on different areas of expertise, and it works extremely well. The Kidney Cancer Research Network of Canada is also something that we an organization that we collaborate with, but we also contribute to financially. And the reason that we do is it isn't just about bench research, it's about research that affects any of you in the audience, such as quality of life, clinical trials, information about genetics, targeted therapies, etc. So it's wonderful to have the connection and in the medical community to be able to share this information with you. So our shared objectives are to try and make sure that in all of Canada that you can gain access to all approved medications, treatments for kidney cancer. And it shouldn't matter whether or not you have insurance, whether or not you live in one province or another. Everyone should be able to access the same treatments, and unfortunately it's not that way. We're trying to increase awareness of the treatment options for kidney cancer with patients and physicians across the country, and part of that is through the Medical Advisory Board also. We want to make sure that there is consistent and a high standard of care throughout Canada, and to support all of you with a better quality of life, or the best quality of life that you can have when you're going through cancer treatment, so that we can provide support in any way we can. And of course, very importantly to all of you, and I know to ourselves, is to increase dollars for funding research in renal cell carcinoma. We are there for patient education and support, as I mentioned, for patients, for caregivers. We have a very credible and I think wonderful website which you should all go on to get any of the information that you need. We have an interactive map which tells you basically where you need to go. We have discussion forums. We have peer support, so people that may have had exactly the same diagnosis as you. If you want to speak to someone that is going through exactly what you're going through or already has, by all means call the 1-800 number and you would be able to speak to someone that will put you in touch with. And it really, we are told it really does help. We're providing patient education meetings just like this one. Our goal is every year to do 6 to 8 regional meetings just like this one. And I noticed the slide is not right. And next year, in 2015 in April, we're doing an all-day patient conference in Calgary. So that one at least is a little closer to home. We do have, as I mentioned, the website. That's one of the pages of the website, the map. We have educational videos. And this, for example, today, this evening, Dr. Moore and Dr. Pasapa's talk will be up and archived on our website. And you can go in at any time to be able to watch any of the videos that are up on YouTube. We have an Ask the Experts section, which I found very, very good when I first started working with kidney cancer, because it's a lot of great explanation about various issues that you need to know about. We have a section on questions to ask your doctor. It may seem silly to say, why would I not know what to ask my doctor, but often you don't. And if you do go online and look at it, it helps, I think, with your relationship with your physician too, in partnering in your healthcare and knowing what questions that you should anticipate asking. And we have top tips too, of course, of being able to go through your experience. These are some of the brochures that we have, and any of them that you want. There's a newsletter, there's all sorts of different information in French and English, and by all means you can email us, go on the website, order them free of charge. They are here in the Cancer Center in the patient education area, so that anything that we maybe ran out of out there, you can get downstairs, or I'm sorry, I don't know the center. I think it's downstairs. And then, as I mentioned, for more information, go to www.kidneycancercanada.ca. And we are also on Twitter for those of you that use it, and Facebook, etc. And we do have videos up on YouTube.